These days, Nguyen is looking forward to the start of the practical nursing program at Holland College in January. Despite being a first-year student, Nguyen is no newcomer to the healthcare field. Originally from Vietnam, he graduated from a medical school back in 2012 and has in total nearly 12 years of experience working in hospitals in Vietnam. Before moving to P.E.I. this summer, Nguyen says he had extensively researched the healthcare needs in Canada and on the island. His hopes was to find a pathway to practice as a doctor in P.E.I.
I always want to become a doctor in any countries that I want to come and live like Canada.
But after looking into the process, Nguyen says he found it to be time-consuming and fraught with barriers. That's a sentiment shared by many internationally trained physicians in Canada who have also faced similar challenges in getting licensed. Nguyen says in order for him to be licensed in Canada, he would need to take an exam with the Royal College of Physicians and Surgeons of Canada and gather quite a lot of documents, including details about his education, training, and a work history spanning 12 years. He acknowledges the fairness of requiring the exam and these documents to demonstrate compliance with Canadian standards, but he estimates the entire process could take years.
Maybe my age is not too young.
How old are you now?
I'm 35. Whole process need time, also need money. So it's a big problem for some doctor who has experience but don't have much time and money.
Nguyen hopes P.E.I. could offer a mentorship program like those in Vietnam, allowing him to work under a Canadian-trained physician who can assess his abilities, therefore expediting the process of getting licensed. But according to P.E.I.'s College of Physicians and Surgeons, that is not an option on the island. Dr. George Carruthers, the college's registrar, says in an email that similar programs exist in a few provinces, usually in collaboration with medical schools. However, P.E.I. lacks a medical school for such collaborations. However, Dr. Carruthers says the province has recently introduced a new associate physician pathway for foreign-trained physicians certified in family medicine or a specialty. This allows them to work under the supervision of a licensed physician. For Nguyen, he has chosen a new path, practical nursing. He says the specific role doesn't matter to him as much as the opportunity to care for islanders.
For me, at first the passion to serve for the patient. Whether you are a doctor or you're a nursing or maybe you're a support worker, your passion is to help other people to have the very good health. So become a doctor, you may prescribe medication for your patients, but being a nurse, you have to directly take care of your patient. And I can use my experience working as a doctor to serve patients better.
Nguyen believes becoming a nurse is the quickest way for him to enter the healthcare field in P.E.I. He plans to complete the 2-year program where he can engage in a practicum and gain work experience. Then upon graduation, he will obtain licensing and start working. In Charlottetown, P.E.I., I'm Thinh Nguyen for SaltWire.